Hello, this is Dr. Von Elten. It's June 21. I'd like to give you an update about COVID. Virginia continues to experience a decline in the rate of infection, hospitalizations, and death of COVID disease over the last month. Wearing masks has proven to be very beneficial, as well as being locked down. But particularly the masks has been very useful. However, don't ease up. Continue to be vigilant. Unfortunately, we still have a long way to go. I'd like to give you an update on testing. There are two different types of testing. One is antigen testing, and the other is antibody testing. Antigen testing is for the acute infection. This is what's typically being done. It's done generally with a nasopharyngeal swab. It is not very useful if the patient is asymptomatic. This detects acute infection. It won't tell you if you've had the disease over the past few months. The antigen test does diagnose an acute infection. So if you're asymptomatic and have a negative test, it doesn't mean that you may not be developing the disease. You could become symptomatic in a day or two, then test positive. Sometimes it can give false reassurance. If you are symptomatic, this is the test to have. And there's two main factors that determine the accuracy. Number one is the way of swabbing. Most commonly it is done by a nasopharyngeal swab, and this has proved to be the most accurate. There's another type of test, which is a self-administered swabbing of the nose. That is not as accurate, or an oral swabbing of the nose, and that is not as accurate. Now, the second thing that determines the accuracy is the timing of the test. If you get tested 3 days before you develop symptoms, say you've been exposed and you're developing infection, you get tested 3 days before, the test invariably is negative. If you get tested 2 days before, the test is about 20% positive. If you get tested the day before, that goes up further. And if you get tested on the first day of symptoms, it's 60% likely to be positive. The highest rate of recovery is on day 3 through 8, with 3 through 8 into the illness. Therefore, timing is everything. For this reason, we require a patient to be screened by a qualified health professional before testing and to help interpret the results. Screening asymptomatic patients yields very little. So there are a few ways the test can be run. PCR is the most common way. The test is obtained and is sent off, and the results come back 2 to 8 days later. However, at Piedmont Family Practice, we have been fortunate to obtain what is called a point-of-care test, a fluorescent immunoassay. Therefore, we get the results within 15 minutes while the patient is still on site and can help interpret the results. This has been a real game changer for us. We are very fortunate to be able to obtain this test. Now, the second type of testing is called antibody testing. This does not test for acute infection. This tests for previous infection. This is a blood test for antibodies the body has produced to fight the infection. And it takes 2 to 4 weeks to produce these antibodies. Therefore, I instruct my patients to wait 4 weeks before having this blood test to see if they have had the coronavirus in the past. Once again, the antibody blood test does not detect acute infection of COVID. If you were ill in February through March, however, this is the test to have. So remember, be safe, continue to wear your face mask, crucially important, social distance, avoid large social gatherings, and continue to wash your hands. Have a good week and be safe. Thank you.